Our AI credit scoring system is officially recognized as a patented technology in Japan, under patent number 7791512. This system is built around high-accuracy risk prediction, using the light GBM gradient boosting method to analyze multiple variables and generate precise risk assessments. Beyond accuracy, explainability is a crucial feature. We use SHAP values to provide clear, understandable reasons for each individual score, ensuring transparency and meeting clinical accountability standards. Another key strength is the fusion of static and dynamic data. By integrating both types, we uncover hidden risks from complex data patterns, which broadens the system's application beyond traditional financial credit scoring to areas like healthcare, including disease risk prediction. Here, we're looking at how AI credit scoring can be applied to predict diabetes risk using routine health check data. Imagine being able to identify people who might develop diabetes early on, just from their checkup results. This is exactly the promise of preventive medicine that AI credit scoring delivers. The data we use includes various health indicators like age, BMI, glucose levels, blood pressure, and family history, as you can see in this sample table. Our target variable is diabetes onset, marked as 1 for those who develop it and 0 for those who don't. We combine both attribute data, such as age, sex, and lifestyle habits, and dynamic data like glucose and blood pressure readings. Once this data is prepared, the same AI technology that assesses financial credit risk can be applied here to predict medical risk, helping healthcare providers intervene earlier and more effectively. Here are just 3 simple steps to get our AI system up and running. Step 1 is training the model. We run the command python train_model.py, which teaches the AI to recognize patterns in health check data related to diabetes onset. Next, step 2 is launching the web app using python webapp.py. This serves the trained model through Flask, creating a scoring API that responds to risk assessments. Finally, step 3 is viewing the results by navigating to http://localhost 8080. Here, high-risk individuals are clearly highlighted in red, making it easy to identify them at a glance. The key advantage is that you don't need to rewrite any code when switching subjects, just swap out the CSV file, and the system adapts perfectly for applications in finance or medicine. Here we take a closer look at the train_model.py script, which acts as the trainer for our AI's risk prediction capabilities. The process is divided into 8 blocks, each playing a key role. First, we ingest and pre-process the CSV data, followed by validating that data to ensure quality. Then comes feature engineering to create meaningful inputs, and categorical encoding to handle non-numeric data. Next, we split the dataset into training and testing parts. At the core is the light GBM training, where the model learns the patterns. After training, we evaluate it using SHAP to understand what drives decisions. Finally, the trained model is exported for future use. Notably, this same 8-block approach is adaptable to healthcare applications, with just the data columns varying. Here we focus on data validation and feature engineering, which are crucial steps before training any model. First, we define the required columns for our medical dataset. Getting this list right is fundamental because it ensures that all necessary information is present for the analysis. Next, we perform range validation to filter out impossible or erroneous values, like ages below 18 or over 100, and negative glucose readings. These checks help catch data entry mistakes early on. Finally, we use feature engineering to create new meaningful variables, like BMI, which is calculated from weight and height. This step enhances the dataset by deriving additional insights that can improve our model's predictive power. Here we're diving into the code walkthrough for training our model using light GBM. The key idea behind gradient boosting is that it repeatedly focuses on the errors from previous rounds and then corrects them in the next, which makes the model progressively better. Looking at the hyperparameters, we've set the objective to binary classification with 700 trees and a very low learning rate of 0.0055 to ensure gradual learning. Because onset cases are relatively rare, they only make up about 5 to 10% of the population we're screening, we apply a class weight of 6 times for these cases. This weighting is crucial because, without it, the model could just predict no risk for everyone and still appear accurate due to the imbalance. Other important parameters include a max depth of 4 to prevent overfitting, regularization terms to reduce complexity, and a column sampling rate of 0.7 to introduce variation among trees. After training the model on 1,000 samples, we check its performance using accuracy and AUC metrics. We achieve an accuracy of 0.9167 with an AUC of 0.8066, which indicates solid discriminative power for identifying onset cases. This approach is especially important clinically because minimizing missed cases can have a significant impact on patient outcomes. By thoughtfully adjusting for class imbalance, we're making the model much more reliable in real-world screening scenarios. Here we dive into the code walkthrough focusing on how SHAP, which stands for Shapley Additive Explanations, gives us accountability for AI predictions that might otherwise seem like a black box. Using SHAP, we apply Tree Explainer to our light GBM model to calculate SHAP values for each individual in our test set. These values help us identify the top 3 drivers influencing a specific prediction. For example, Patient A, a 45-year-old male flagged as high risk with a diabetes onset score of 0.72, shows that fasting glucose, BMI, and family history contribute positively to his risk. Exercise hours, on the other hand, have a negative impact, suggesting it's protective. The physician's note highlights that focusing on glucose levels and BMI, along with exercise guidance, could be key in managing this patient's risk. This approach makes AI predictions much more understandable and actionable. Here we have a live demo to assess if an individual with these health check results is at risk. The person is a 45-year-old male with a BMI of 28.4, which indicates mild obesity. His fasting glucose level is 112 mg per deciliter, slightly above the normal range, and his HbA1c is 6.1%. Blood pressure is elevated at 138/85 mm of mercury. He also has a family history of diabetes, with his father affected, and he exercises less than once a week. Based on these inputs, the AI credit scoring model assigns a risk score of 0.72, indicating high risk and recommending further testing and lifestyle guidance. The top 3 factors driving this risk assessment, indicated by SHAP values, are the fasting glucose crossing the borderline at 2.34, BMI contributing 1.42 due to obesity-driven insulin resistance, and family history adding 0.91 as a genetic risk factor. It's important to remember that this tool is designed for early risk detection and is not a substitute for a physician's diagnosis. Now, let's talk about how you can access the code we've discussed. Everything we've demonstrated today is available on GitHub, so you can download it directly from there. With a Python environment ready, you can run the same experiments yourself right away. All you need to do is swap in the medical data of your choice, and you can try your own risk prediction models. For example, by replacing the required columns in the train_model.py file with relevant medical fields, you'll have your own diabetes risk prediction model up and running. This hands-on approach lets you customize and explore the possibilities in medical AI modeling. Now, let's look ahead to what's coming next. We'll focus on predicting hospital readmission risk, which means using AI to estimate the likelihood that a patient discharged from the hospital will be readmitted within 30 days. This prediction is based on key factors like vital signs, lab values, and patient history at the time of discharge, providing crucial support for discharge decisions. We'll also delve into cardiac risk scoring, where AI analyzes screening and lifestyle data to predict the risk of heart attacks and strokes, helping guide preventive care efforts. Additionally, we'll explore treatment response predictions, using AI to determine which drug is most likely to be effective for each patient. This represents a significant step toward precision medicine. Later in the series, we'll expand beyond healthcare to examine cross-industry AI applications, including HR attrition, manufacturing equipment failure, and cybersecurity intrusion detection. So, stay tuned for more exciting insights. Thank you so much for watching. If you found this helpful, please make sure to subscribe and give us a like. Feel free to visit our website at Uratasoft, and check out our projects on GitHub. Just a quick note, our AI credit scoring system is protected under Japanese patent number 7791512. We appreciate your support.